like this. Okay, so all of this is to test any to see if there's any issues with range of motion, if there's any pain with the patient, and there isn't any limited range of motion with my patient. Everything, she was able to move her neck at like the different degrees. If there were limited range of motion, it would be because of neck injuries or osteoarthritis or disc degeneration. The next thing that we're going to look at is they're going to test the range of motion of the thoracic and lumbar spine. We're going to have the patient bend forward and touch the toes. And we're going to look for some symmetry of the shoulders, scapula, and hips. There should be a flexion of 75 to 90 degrees. Her movement should be smooth, and there should be a lumbar concavity. The lumbar concavity should flatten out, and the spinal process should be aligned. So now we're going to have the patient demonstrate that movement. So the patient's gonna go and bend over and touch her toes. And we're looking at her back. We're looking to make sure everything's symmetrical. Shoulders are symmetrical. The lumbar region is flat. There is, let's see. The spinous process is aligned, and there's symmetry in her shoulders, scapula, and hips, which with my patient there is. Thank you so much. You can get back up. Okay. Again, any abnormalities would be due to muscle or joint diseases. The next thing that we're going to look at is we're going to have the patient do the flexion on the lateral flexion on both sides, again to test any limited range of motion. And we're also going to have the patient do a 30 degrees rotation. To do this, we're just going to have the patient just move to the side like this, okay, and do the same thing on this side. And then you can go back straight. We're going to have the patient go like this and like this. Okay, so as I'm looking at my patient, she was able to do both of those movements, and she didn't have any. Or did you have any pain when you were doing that? No, and I didn't know any limited range of motion while she was doing that. So again, that is that's normal. Now, if the client had back pain or leg pain, do you have back pain or leg pain?
No.
Okay. Well, if the client did, we would have the client lie flat, and we're going to raise each leg independently to check for pain, to check for dorsiflexion of the toe of her feet. And to know any degree of elevation when there's pain that occurs. Okay. We would also measure the length of her legs, and I can see, because of her even shoulders and her even symmetrical buttocks area, she does not have like one leg longer than the other, but typically if you suspect that one leg is longer than the other, you'd have the patient lie down and you would measure both legs to find to confirm that one leg is longer than the other. All right, now the next thing is that we're going to do, we're going to check the range of motion of the shoulders and arms. Okay, we're going to inspect, palpate, and test the range of motion and strength. So stay right here. Her shoulders, like I've said before, are symmetrical, and her arms are the same length. Okay. We're going to have her hyper extend her arm. So we're gonna have her go back like this, hyper extend it. Okay, and then we're gonna have a forward flexion by raising it up. And then you can bring it back down. And then we're gonna have her abduct by raising her hand up to the sky. And then abduct by bringing it back to her side. Again, abduct with the B, up. Adduct with the 2 D's is down to the side. We're going to check the range of motion of the shoulders by doing the external rotation. We're going to have the patient bring her arm back to her head like this. Okay. And then down to her lower back like that. And the internal rotation and external rotation should be about 90 degrees. All right. Okay. Let's see. The next range of motion that we're going to check is flexion and extension. So we're going to have the patient have her hands like this, and actually put it to the side. Then we're going to bring it up for flexion, and we're going to bring it down for extension. Up for flexion, down for extension. The next thing we're going to look at is supination and pronation. And we're going to use this book here. We're going to have the client place her hand on the book and bring it back up. Place it flat and bring it back up. So place your hand on the book like this. Go flat. And that is pronation. And go like this. Supination. Again. Pronation and supination. Perfect. Thank you. And now we're gonna have the patient, we're gonna inspect and palpate the patient's wrist and hands and fingers. Okay, so what I'm looking for is any sign of tenderness. We're looking for symmetry. We're looking at the color, the shape, and size. Okay, so let me see this.